In our practice, we focus on a variety of conditions and diseases of the colon and rectum, such as screening colonoscopy for colon cancer, treatment of colon cancer with advanced laparoscopic techniques such as the single incision laparoscopic colon surgery. We also treat diverticulitis, inflammatory bowel diseases, and other conditions such as hemorrhoids. In our practice, we have developed the Pelvic Floor Center that specifically addresses conditions such as fecal incontinence, pelvic pain. We provide comprehensive diagnosis and treatment plan for these conditions in our clinic on an outpatient basis. Most of these procedures and treatment can be performed in our clinic and rarely require a surgical procedure in the hospital.
I'm Ashley Wray. I'm a physician assistant here at Colorectal Surgery Clinic with Dr. Voloyannis. I do all different kinds of things with him. I assist in the OR, you'll see me in the hospital, you'll see me here at the clinic. So there's a nice strong fluidity of care between the two of us. Fecal incontinence is the weakening of the pelvic floor muscles, and most specifically the sphincter muscle over time, such that you lose the ability to control gas, liquid, and even solid stool. Signs and symptoms include accidents to gas, maybe once a week or multiple times a week, accidents to stool, where you maybe just see a little bit on your underwear several times a week, or even full accidents where you have to change your clothes more than once a week. There are actually several risks of fecal incontinence. The main ones being age. As we get older, remember our pelvic floor muscles, they begin to atrophy and weaken over time. Having previous pregnancies, multiple pregnancies in the past, even obstetric trauma where you've maybe had spontaneous tearing or episiotomies. And then even previous anorectal procedures. So hemorrhoidectomies is a good example of a procedure that could increase your risk of having fecal incontinence. There are multiple ways to treat fecal incontinence, and many of our patients here in the clinic are eligible for non-surgical management. And the way that we do that is through pelvic floor muscle retraining, which is a unique, minimally invasive training method whereby we use advancements in technology to help you re-strengthen and regain those pelvic floor muscles that may have aged over time. So it's a system whereby we use a rectal or vaginal sensor to teach you how to voluntarily contract and relax your pelvic floor muscles correctly. The nice thing is that we can document your progress, so you can see how your strength is increasing over time. The goal really for pelvic floor retraining is greater than 50% improvement in symptoms and to really prolong surgical management as long as possible. So we really want you to leave here feeling confident, not always looking for a bathroom, and to get you back to your normal daily activities. Many of our patients have been living with these symptoms for years, 10, 20, sometimes even 30 years, and there are actually many more patients who have fecal incontinence than you would think. So our goal is really to help you realize that you don't have to feel ashamed, you don't have to feel embarrassed, and there actually is something that you can do about it.